news stories. Welcome to the stream. We got another Camper Live where we're going to go over some of the biggest news in obesity medicine from this week. We're going to talk about all of that live, and we're going to take your questions as well. So as you're jumping in here, drop an N in the chat next to your name if you're new. I would love to welcome you by name. And if you're an OG, put OG in the chat. Let me know where you're watching from and what you're up to today. I know a lot of people are probably watching football today. But thanks for being here with me, where we're going to go over again some of the bigger news stories from this past week in obesity medicine news. If you're new here, my name is Dave Knapp. I'm the man on the Manjaro. This whole thing is called On the Pen. It is an obesity medicine news platform designed to give news that flows out about obesity medicine from the patient perspective, all empowering you to have more competent and confident conversations with your medical providing team. We talk about the current landscape of treatments and accessibility. We talk about the future treatments of these medications. We talk about insurance. We talk about it all. We talk about the journey as well. So Woodkirky, welcome. Akiwartu, welcome. Thanks for watching over on TikTok. He said this is his first time watching TikTok Live. Welcome to Liz, to Margaret, to Shelly and Lois who are watching over on YouTube. Don't forget to hit the thumbs up button while you're just jumping in here. That helps the algorithm know that this is worth other people seeing. Shelton, welcome, watching from Georgia. Michael Clanton and OG for sure. Welcome, Angie. Welcome. Thanks for being here. Good to have you all here. So this is going to be an interactive live. I'm going to take your questions, but we're going to jump into some of the news from this past week in obesity medicine and just kind of talk through it until you want to change the topic. But we're going to talk about a couple of the lawsuits that Lilly has filed, Eli Lilly has filed against both Willow Health and Mochi Health. Now, the Willow Health lawsuit was about Willow actually tangible evidence of lost prescriptions, physician testimony, whatever Lilly could come up with. And ultimately, in that case, the judge echoed the sentiment from the judge over in on the Mochi trial or lawsuit, and basically said, hey, you can't provide any evidence. I'm tossing this thing out. So Lilly has 30 days, I think, to respond to all of that, but I believe that the Willow Health lawsuit has been thrown out, and the Mochi Health is right behind it. Lilly, that's the case where Lilly has 30 days, I think, to basically bolster up their case. If not, that case is likely to be thrown out as well. That lawsuit is likely to be thrown out as well. So you have two instances where Eli Lilly has actually gone after a large telehealth platform and unsuccessfully been able to do anything with it. So, when we talk about the future landscape of compounded versions of GLP-1s, my own personal opinion happens to be that they're not going anywhere. You actually see the 503B pharmacies now getting back into the game. Now, the 503Bs had historically been established to help serve patients when a drug is in a declared shortage. You saw the Outsourcing Facilities Association that represents these 503B pharmacies actually sue the FDA over this decision for both semaglutide and tirzepatide. Ended up losing both of those cases, but some of those 503Bs are now firing back up, making these custom doses and custom formulations, sort of acting as 503A pharmacies for personalized medications, which are allowed outside of these shortages ending. And so 503Bs are getting back into it. That seems to me to signal that they feel pretty strongly that they have the legal authority to do what they're doing. And so I just don't see compound medication going away, especially because what we see right now is decreased access to these branded medications through insurance plans. We thought that over time we would see an increase. What I'm seeing, regardless of what the pharmaceutical companies are saying, what I'm seeing is more people are actually losing coverage than gaining coverage to obesity medication. And it's unfortunate, to say the very least. Thank you for joining in here over on TikTok. I see lots of people sharing the live. It's good to have you here. We're talking about all things obesity medicine, all the news stories that empower you to have more competent and confident conversations with your doctor. So the trial for Willow Health thrown out. The trial for Mochi still ongoing. Lilly has about 30 days to bolster their case. If they can't, that case will likely be thrown out as well. And you, in the background, have two 503B pharmacies now actually actively challenging Eli Lilly's tirzepatide patents. So that's a huge deal because they're going right for the patent. Now, there's a lot to get into, and we actually discussed this on a long form video over on YouTube just a couple of days ago, but to just quickly fly over it, it doesn't mean that we'll have generics any sooner. It's just legal cover for these compound pharmacies to continue what they're doing, as they'll all be sued, I'm sure, ultimately by Lilly. You already see Empower's being sued, Strive's being sued, a couple of compounding pharmacies. I imagine BPI, who is a massive 503B outsourcing facility, who's got into the game, back into the tirzepatide game this past month. I think you'll see them probably sued by Eli Lilly. So I think they're getting ahead of it with these patent challenges. We'll see what happens. Michael has a question over on YouTube. Michael's question is, after all this time, still no after best use by date lifespan on GLPs. There is a really wide variety of answers on that question, depending on where the medication comes from and what additives are added to ensure that these drugs are stable and sterile for a long period of time. Now, I've seen some best by use dates go out all the way to a year, but I've also heard anecdotally from patients who have used these medications and then ultimately did not find that the medication was that powerful after a period of time. So I think that's part of the wild west that we're in of compounds, and I think that's sort of an interesting thing. Over on TikTok, somebody said reported. What do you mean? We're reporting on all the news. We're just reporting on all the news in obesity medicine is what we're doing. So if you find that information helpful, please follow along. We're actually part of my going live today is a goal to get to at least 15,000 followers on Instagram. So if you could jump over to my Linktree and follow me on Instagram, our TikTok account has a ban warning on it. So if you can help me grow the Instagram, I'd love to get that to give it to 20,000. But my goal with this live today is to get it to at least 15,000. We just need a couple hundred. So between the 100 that are watching on TikTok and the 71 that are watching on YouTube and Twitter, if you could just jump over to my Linktree and follow my Instagram account, it'd be greatly appreciated. That's part of my goal again for this live stream. Other questions that anyone may have. I have info from Condi Carmack on frozen reconstituted GLP-1. That is definitely something I'd be interested. Send me some more information if you've got it, Michael. I'd love to see it. Trying to comb the comments here for other questions here. I appreciate everyone who's sharing the live over on TikTok. Thank you for those who are hitting the thumbs up button over on YouTube. So yeah, thanks, Michael. I appreciate that. Let's see. Let's get into some of the other news from this past week while we're waiting for anyone who has other questions about the landscape of GLPs. We are launching On the Pen Live, just kind of a channel update. We're launching On the Pen Live again this week. It'll be on Thursday nights, probably 7 p.m. Central Time. Thursday nights will be On the Pen Live coming back this week. Really excited for that. So wanted to make sure that you are aware of that coming into the fold. Let's see here. We got some really interesting news from Teva Pharmaceuticals, who is actually bringing a generic version of liraglutide to the market. This is the obesity version. Now, the obesity version comes in like almost twice the dose, the daily dose, as the diabetes version of Victoza. So you have Saxenda, Victoza. Those are the branded names of liraglutide. We heard from Teva, who makes the generic version of the diabetes version of liraglutide, now making the obesity version as well. The list price on that is $1,100. $1,100, where this in a landscape where you can get both Zepbound and Wegovy for $499 cash paid directly through the manufacturer. How and who's going to use this? I think most people have posited that those that may use this who have insurance coverage for adolescents, because it's apparently approved for adolescents. But other than that, I don't know who's going to be using liraglutide at that price point, unless the insurance companies are getting a massive rebate on that. And yeah, we'll have to see. We'll have to see kind of what shakes down. But that was like the news to me that just was, again, an indication of how badly we need PBM reform in this country, because, if its list price is $1,100, these are massive rebates being paid to the pharmacy benefit managers to gatekeep access to these branded and generic medications, which is just absolutely criminal from a patient perspective. Getting into some of the other interesting news, last week Novo Nordisk actually claimed that Wegovy was 57% better at reducing heart attack, stroke, and death than tirzepatide. And we kind of broke down on the podcast this week that study was a very short study, 3 to 4 months on average. The event count was tiny, so we were comparing about 15 of those events to 39 of those events, and patients essentially were only followed for a very short amount of time. Now, when you look at the actual clinical trials, placebo-controlled clinical trials that have gone on in testing the protectiveness of the heart with these GLP-1 medications, is that these studies last 3 to 4 years. And so looking at 3 to 4 months of marketing data doesn't do a whole lot to prove anything. So this was more of a marketing gimmick and than anything else. But I do think it is one more data point that does show that GLP-1 receptor agonism may actually have a specific benefit to the heart that you don't get with dual agonism like GIP. Now, for most people, this is getting into the nerd science, but tirzepatide is 5-to-1 GIP to GLP-1. And because it's more GIP than it is GLP-1. And so that could be an indicator that the GLP-1 is actually, doing some unique things in the cells of the heart that GIP does not. We've actually seen a study that came out in Endo 2025. We did a big Substack write-up on this that actually showed that GLP-1 actually opens up these parasites on the cells of the heart, which actually help to restore blood flow to areas of the heart that wouldn't otherwise have blood flow after a heart attack. Now, this was really, really powerful news, and it was shown in a GLP-1 receptor agonist, exenatide, which was the first one. So there's no GIP in that. So it could be that GLP-1, and then conversely, they actually blocked Michael wants to know if I have RLS, a restless leg. Yeah, I move around a lot. I don't know if I have restless leg syndrome, but I do. I'm always jiggling my legs, and I think more of it's an ADHD thing than anything. Yeah, I swing a lot. I move around a lot. It tends to drive people nuts. But these parasites on the heart are like trap doors that are opened by GLP-1. And then the flip side of it, and this was a rodent study, they blocked those parasites, used a GLP-1 blocker, and found that the opposite happened. It closed them off. And so one of the things that you do find is that these medications, these GLP-1 medications, are showing to be cardiac protective in a very specific and unique way. And so that'll be interesting. Some say that they can't hear me because of the wind. I apologize. Not a whole lot I can do with that. So sorry if that's bothering you. Let's see here. Any news on Retta coming to market? There's no new news on that. I think that what we'll see is that we'll hit the market probably in early 2027. But we'll get orforglipron before that. So we'll see. Hey, Dave, appreciate your content. It's incredibly informative. I'm happy since starting my journey to become healthy. That's amazing. The heart health news is amazing. Been pointing everyone to OTP. I really appreciate that, Zen Siren. Thank you for anyone who points people to On the Pen for obesity medicine news. I greatly appreciate you. Really appreciate it. Tricia says the audio is all good now. I appreciate that. Hello from NYC, says Shelly on the jab. What do you think will come of the class action lawsuit against PBM CVS Caremark? Also, since they have an agreement with Novo Nordisk. So that's a really great, for those of you have missed this news, Claimable is a company that we've been working with it On the Pen for about, a couple of months now. Claimable is helping patients who have lost coverage, insurance coverage to their branded Zepbound, get back on it. So they're helping patients do insurance prior authorization battles, basically. You can check them out at getclaimable.com/OTP and code OTP code OTP10 saves 10%. It's all in my link tree. Claimable, what they found was that CVS Caremark was continuing to deny patients of their Zepbound on illegal grounds, in their opinion. And so they've organized a class action lawsuit. And so there's a lawsuit going against Claimable right now. We're going to have a way for for patients who are interested to get involved in that class action lawsuit. But what I think will happen is that if CVS Caremark is doing things that are illegal, I think they're going to get called to the carpet on it. And I hope that they do at the end of the day. And I hope that they reverse their decision to put all these patients who are on Zepbound, a superior drug, to the inferior Wegovy. And I'm going, when I say superior, I'm going by the clinical trials. 16% body weight in 68 weeks for semaglutide. And with tirzepatide, you have nearly 22% body weight loss in 72 weeks. So better on the weight loss front, but also you have the GIP agonism that seems to be helpful in things like obstructive, mild to moderate obstructive sleep apnea, inflammation reduction, lipid reduction, liver fat reduction. And so it's not a one-for-one swap. It's a totally different medication acting primarily on an entirely different hormone. And so I think that will be an important lawsuit, and we'll be following it very closely. And that was brought by members of our On the Pen community who were pointed to claimable and then claimable organized people who were getting the runaround from CVS Caremark, and in their opinion felt like they were breaking the law doing so. So I hope they're called to the carpet, and ultimately I hope this causes these companies to follow the law and to give access to more patients to medication that their doctor decides. Because ultimately at the heart of this is the fact that we have PBMs practicing medicine. It just shouldn't happen. And they're doing it because there's these non-transparent rebate deals that we don't know anything about as consumers. They work these deals in the background, and they're paid to steer your treatment. They shouldn't be allowed to do that. That should be a decision that's made between a doctor and a patient. So I hope that they're called to the carpet. Good to catch you live here with us, Sandra. Thank you for being here. Really appreciate that. Do I see GLP-1 costs coming down this year? It depends on who you are. I see them coming down potentially on the compounded front. There's just more and more competition there, which I think we've seen. Compounders have really brought a level of competition to the market. I think that's why that's the main reason why these pharmaceutical companies want to see them go away, is because it is creating a competitive market for the price of these medications. So yes, I do believe they'll continue to go down. I do believe we'll see a price cut, an aggressive price cut to Wegovy by the end of the year. It'll be interesting to see if Lilly moves the cost of the cash pay vials down after raising the price over in Europe. So I do believe that we will see some price changes and some price movement in expanding access, which is positive. I don't know how much that will be. I hope it's significant for Wegovy, especially. It's a much inferior drug. It's insane to me that they can charge the same that they're charging for Zepbound. So we'll see. Spoonie, I highly recommend. I can put you in contact with my friends at Claimable. I think that they'll be able to help you out. Greetings. You were answering about a good compound company yesterday during your live, but was cut off, so I missed your answer. So asking about good compounding, if you're on compound tirzepatide, of course we work with Roe. Roe does not offer compound tirzepatide, so if the vials are too expensive for you, then compound may be an option for you. And I think a really great tool to check out is GLP Winner. Our friend Sabina runs this website, and it just allows you to sort of compare and contrast what pharmacies things are coming from. Like, so I worry less about price for patients and more about where the meds are coming from, because I think not all sources are created equal. And so you want to, again, 503Bs are governed by their state. 503Bs are governed by the current goods and manufacturing product, which falls under the FDA. So you know that they've been federally inspected and are having to comply with regulations about where the API comes from. 503A are a different story. Those are governed by their state pharmacy board. So if you want to make sure that your state pharmacy board is inspecting the pharmacy, you got to know what pharmacy your medicines are coming from. So they're not all created equal. And I just hope that you'll check out where the medicine's coming from, because that's really more important to me than anything. Hey, RJ, how are you? The last resource, it's glpwinner.com. glpwinner.com. Thanks, Mike. I appreciate that. Michael says, after all this time, I feel like I'm getting to know you better about how you operate. Losing the video feed, so I don't know why that happens. But yes, I have ADHD. It's untreated. I have been taking a nicotine product called Knick Knack. It's pure nicotine. That does seem to help me. kind of gets my brain in the zone. So I don't respond super well to caffeine. So this, I found, it works with me if I do a small enough dose. Keeps my heart rate low and my focus high. But yeah, I have ADHD. Sorry that the ticking and the rocking and the getting sidetracked is something that happens to me quite frequently. But it's also the part of me that I feel like is when the reason I don't take medicine for it is because all the medicine out there changes my personality, and I lose some of the creativeness and the creativity that ultimately would flow out of that same kind of spot that the ADD seems to flow from. So when I blunt that with medicine, I feel like I'm also blunting my creativity and part of my personality. So I just don't like that for me personally. The medicine does really help me though. So I appreciate you cheering me on. Some love for Ro in the chat from our friend Spoonie. Thank you. I appreciate that. You're curious about the studies of various dosing over time. Personally been successful on low doses. Any news on these various topics? Well, I think, ultimately these clinical trials for these medications are designed to get people to the highest dose because these medications have been shown to be dose dependent. So the higher the dose, the more people tend to lose. But that's definitely not the case for everybody, because when we talk about the disease of obesity and metabolic syndrome, it's definitely a sliding scale. There's a spectrum, right? So if you're over here on the spectrum, you may need less medicine. If you're over here, you may need more and different medication. It depends on the level and the severity of the disease. Some of the future medications that will deal with more severe disease, like retatrutide or even bioglutide, some of these, triple, quadruple agonists that are in the pipeline are really going to be good for people that are on these medications who don't respond as well, because typically they just have a higher degree of disease that needs different or more treatment. So if you're staying on a low dose, I think that seems to be the conventional wisdom between most doctors who prescribe these nowadays. Most of them that I talk to say low and slow, because many people do respond to the lower doses. But conversely, if you're on a lower dose and you just think you're going to stay there and you're not losing weight, these medications have been shown over and over in clinical trials to be dose dependent. So the higher the dose, the more the weight loss in the clinical trials. Nancy says, I look great, more weight loss. So happy for you. Thank you very much. I have definitely attributed my recent weight loss and success therein for the reduction in the elimination of alcohol from the diet, but also using my Shape-A scale. So this is a numberless scale that I use that helps me to stay in the game mentally, instead of looking at a number and potentially getting dejected by that number every day. I get on and I'm aiming for a color range, which is a pattern of my weight. You can check more about it. The link is in the description of this video or in my link tree. But the Shape-A scale is the numberless scale. So it's 7 days of rolling data that's helping you track average trends instead of daily fluctuations. The daily fluctuations throw me off. So I got rid of the booze and I got added into it the numberless scale, which has allowed me to stay accountable and trying to stay and shoot for staying in the same color range each and every week. So I'm just staying engaged with the scale. And when I'm engaged with the scale, I'm engaged with my health. And so these have been the two major changes that I have made to my own personal journey. We can save you 30% with code OTP30 at myshapea.com/OTP if you want to learn more about it. Let's see. Michael says, looking into Solank in intranasal spray. Hey, buddy, what you doing?
You have $30.
$30? For what?
For this.
For a game?
No. Yeah.
All right, not right now, bud.
Well, I only have one game.
What?
I want to add on because they don't have any.
Are you getting too bored with that?
Yeah.
Oh, that's tragic. This is Benny, who's hanging out with me right now. Benny is my 5-year-old.
Mm-hmm.
Are you 5?
Mm-hmm.
Are you a big guy, kid?
Mm-hmm.
Do you weigh your dad?
Mm-hmm.
Oh, you did, my little buddy guy. I weigh you. You did a good guy. Don't apologize for it. Let's see here. Trying to jump down. Sean says Dr. Rosen said fidgeting helps burn calories. Yeah, well, I must be burning a lot for sure. Must be burning a lot. I'll take any other questions. Otherwise, I'll move through some of the other stuff that I have to get to today. So one of the big things that I keep talking about is I'm not a fan of these new small molecule GLP-1 drugs. You might be like, what does that even mean? Well, the small molecule drugs, so everything that we have now for obesity medicine and of GLP-1 receptor agonism or GIP receptor agonism. We call them incretins. Everything that we have right now is a peptide, and peptides are absorbed into your bloodstream and metabolized differently than the small molecule drugs. Now, the small molecule drugs are actually metabolized in your liver, like acetaminophen is, which also means that for many people who have got into and so I lost my train of thought. We're talking about these small molecules. So other companies that have got into the small molecule game have actually abandoned these medications because they cause liver damage. Now, orforglipron has never been shown to have liver signals, but they also have a very low dosing regimen. So in phase 2, they went up to 45 milligrams. When they got to phase 3, the longer trials, they capped it at 36 milligrams. So why did they do that? Did they do that because there's a potential liver signal there if people take more? My concern is they're not very effective compared to the injectables still. I think for most people, they'll struggle, and I'm concerned about people taking more than is prescribed because I already know thousands of people do that with the peptides, but there's more inherent danger and risk doing that with small molecules than there is with the peptide versions. And I'm just concerned about how that's going to happen, what's going to happen to patients who do that. Don't do that. And I've already seen these pop up on the research sites. And so that concerns me as well, because these are metabolized differently. And so there are some benefits to it. It's more stable than the peptide oral versions. It's not like such a gremlin of a medicine where there's so many rules about how and when you can take it. But there are these potential liver signals. Pfizer actually abandoned one called danuglipron. It was a twice daily. They started having liver signals in the trials. Then they dropped it to once daily, and they still had liver signals, so they had to drop it. Well, the news from this past week is that Eli Lilly actually dropped 2 mid-stage trials for napiriglipron. I'm not even sure if I'm saying that correctly. Napiriglipron is what I'm going to go with. It is another small molecule GLP-1 receptor agonist in middle stages, and Lilly just dropped it. Did they drop it because there were liver signals, or did they drop it just because orforglipron is the one they're going to hang their hat on? I don't know that we'll ever know the answer to that question, but these small molecule ones are the ones to watch, because if they ultimately are less effective, and if they ultimately cause damage to people who take too many of them or too much of them, which is completely unadvisable, but if people do that, I worry about how that could ruin and be fodder for the whole class of medications to get a bad rap. And so I'm not a huge fan about these small molecule GLP-1 drugs, which are metabolized again in the liver and have potential issues that others do not. So that is ultimately my concern. And we just saw Eli Lilly abandon 2 mid-stage trials. And so something to watch, something to be aware of. Again, what we aim to do here. Hey, Robbie, how are you? What we aim to do here at On the Pen is to give you straight information that you can take to your doctor and have more competent and confident conversations with those doctors. And so that is what we're trying to do with this information, just so you're armed with the facts, right? Napiriglipron. Back up, buddy. Okay.
Can you get $30?
Not right now, bud.
What do you have?
I do have $30, believe it or not.
Can you do it after your call?
We'll see. We'll see, bud. Okay, but you need to skedaddle. Okay? I love you. He's my wild card child. Question over here on YouTube from Nancy said, how about NAD? So NAD is nicotinamide adenine dinucleotide. All right. So it's a critical molecule that's actually found in every cell of your body, which plays a central role in your metabolism and energy, DNA repair, overall cellular health. And so it's sort of become this buzzword or popular topic of conversation in sort of the anti-aging longevity space, and even in weight loss. So NAD plus is a coenzyme, meaning it helps enzymes to do their jobs. It exists in 2 forms, NAD in the oxidized form, or NADH reduced form. And its most important job is actually to help turn the food you eat into energy through the metabolic process like glycolysis. And so, ultimately what people think it can do is that it can help with longevity. It can possible beneficial molecules to take. But again, it's something to definitely talk with your doctor about, because just like with anything, there can be danger when it comes to anything you put into your body. NAD plus helps all cells function. So could it potentially like help the dangerous ones like cancerous cells? These are questions that maybe still unanswered. So especially if you have a family history of cancer, you want to talk to your doctor before taking something like NAD. If you have headaches, nausea, fatigue, anxiety, these are things that may be exacerbated by something like NAD. So just, it's one of those things where more and more people are pushing these. And so it's just something to be informed about before you go jump into it. I know that there's a lot of research stuff out there. So if you're going to do that, just talk to your doctor first is what I say. Just be careful. You can never err on the side of caution and being careful with this stuff, because there's a lot of stuff popping up. But again, there's no free lunch and there's trade-offs with everything and potential risk involved. You just want to inform yourself of what that is. I'm not a medical professional. This is not medical advice, but your doctor can give all that to you. And so hopefully you can take the conversations that we have and go have better conversations with your doctor about it. How can I help you, son?
Dad, what Sawyer was just joking. It's actually just $20.
Oh, he was just joking about the $30 is just 20.
Do you have 20?
I also have $20. If I have 30, do I have 20? Which number is bigger?
30.
Yeah, 30 is bigger. So if I have 30, do I also have 20? Because 20 is a lower number, right? Yeah. But we'll talk about this when I'm done doing this live stream. Is probably look at me. It's a better conversation to have when I'm not live and talking to other people, right? So if you can be patient, we can talk about maybe a way that we could earn that or do that, but we're going to do that when Daddy's done working. Okay? Appreciate it.
If Sawyer or people want to do Goggleball, can we?
Sure.
Okay.
Yeah. Oh, Ben, he's such a nice kid. He's a good guy. What are my thoughts about the use of other peptides along with GLP-1, since a lot have not gone through clinical trials? I think just because a pharmaceutical company hasn't brought something to market doesn't mean that there's no benefit from it or potential benefit from it. I think it's just cause for more caution, especially getting into some of these like NAD plus, where perhaps if you have a family history of cancer or a personal history of cancer, you don't want to be promoting the growth of cancerous cells, and some of these can be that way. And so I think other peptides are going to be just fine to combine with the GLP-1, but it's definitely something you want to talk to your doctor about first. Given your family history, I mean, there's things like BPC 157 that people I've taken that before to help get over strains and pulls and things like that, especially as we get older. But again, there's just things you want to be aware of when you talk about these, that your doctor should help have that conversation with you. And if you feel like your doctor is just not open-minded enough, it may be time to have a different doctor, right? Or maybe see another one that can give you the information that you're looking for. 503A versus 503B. I always say 503B or it's not for me. The reason I say that is 503Bs are governed by the current goods and manufacturing process, which means the FDA has oversight into where they're getting their active pharmaceutical ingredients. So the actual drug that they're using to compound your medication, the source of that is important and it matters. And the FDA, there's federal oversight over that with 503Bs. You don't get that with 503As. 503As have a state pharmacy board inspecting what they do, and there's just more variation from state to state, depending on what state you're in, as to how often places are inspected, what kind of resources the pharmacy board actually has to inspect and enforce. And unless you're on the up and up in that, and very few people are, it's just easier if it's coming from a 503B, because there's some uniform guidance that they have to follow in order to stay in compliance with the FDA. So there's FDA oversight at the 503B level that there isn't at the 503A. That's why I like 503Bs. That's not saying that 503As are inherently bad. There's just more of a variety of information to consider if that's where your source of medication is coming from. Delisa, can never remember how to say that name. It's been a while, but it's good to see you. How are you today? Good to have you here. Michael says NAD is good for energy. That's great. True about anxiety. That was a personal struggle at first, but it got easier over time. Yes, and I've had dealt with anxiety before as well. Shelly is here for the boy questions, Sir Benny's questions. He is not taking no for an answer. He is my absolutely what is the word? Persistent. He's one of my persistent children. Persistence is a great quality to have. You don't want to coach that out of your kids, but at the same time, as a parent, can be one of the most obnoxious qualities that a child can have. So yeah. Jasal said, greetings, Dave. This is Robin from India. I received my first dose of Mounjaro 4 days ago. My weight goal is 63 kgs. Could you provide an estimated time frame for achieving this? So when we talk about pounds, it's more important, I think, to talk about percentage of body weight loss, because are you starting at 500 pounds? Are you starting at 200 pounds? So the amount of weight you're looking to lose is more easy to talk about in terms of percentage. But when you talk about the maximum amount that people lost on tirzepatide in the obesity trials, non-diabetes trials, and if you're in India, it doesn't matter whether you're taking it for obesity or diabetes, is still called Mounjaro. So it depends again on whether you're diabetic or not. But in the obesity trials, patients lost 22% of their body weight in about 72 weeks, right? But that said, I think most of that weight is lost earlier on by about week 40. And so in the trials for Wegovy, you saw patients lose up to 16% of their body weight in 16 weeks. Again, probably most of that weight loss by about week 40, right? And you're titrating up to these higher doses. These are dose dependent medications, meaning that the higher dose, the more patients lost in the clinical trials. And so I think it's just important to know that it's going to be different for everybody. And it's hard to figure out how much weight you're going to lose because it matters what your starting weight is. But again, 22% seems to be about the ceiling for most people with tirzepatide. A lot of people go way above that. A lot of people are way under it. If you're diabetic, conversely, you can expect to lose anywhere from 12 to about 14% of your body weight on a GLP-1, depending on which one you're on. And again, going by the average. Somebody over on TikTok is asking about Tesamorelin. Now, there's a lot more of these questions because a lot of these companies are pushing, a lot of these telehealth companies are now pushing some of these other peptides in addition to GLP-1. So I don't know, a tremendous amount of Tesamorelin. I've never used it myself, but it is a prescription peptide that's supposed to stimulate your natural human growth hormone. So unlike like direct HGH, which actually encourages your own pituitary gland to do the work, or unlike HGH injections that are straight analogs, Tesamorelin actually encourages your own pituitary gland to make HGH. So it's ultimately another daily sub-Q injection to supposedly help treat excess abdominal fat. I mean, as a good add-on to GLP-1, maybe it's again something to talk to your doctor about. But again, it's not going to be a good substitute in terms of like how much weight you could potentially lose compared to a GLP-1. GLP-1s are the most effective treatments that we have for weight loss. Looking at the studies, there are some risks that people talk about with Tesamorelin that I've heard. Again, I'm not a medical provider. I'm not an expert in this stuff, but I've heard about the potential for increasing your insulin resistance. So if you're diabetic, Tesamorelin boosts a chemical in your body called IGF-1 and growth hormone, both of which antagonize insulin production. So if you are already, GLP-1s actually antagonize insulin production too. So if you are raising your blood sugar and you have an overabundance of insulin, it makes it very hard to lose weight. So in some ways it could work against you. So again, these are all great conversations to have with your doctor. For some people, it's going to make sense. And for some people, it's not going to make sense. And so it's just, I think, important for you to work that out with your doctor. Word Kirky, this is a piece of news that I haven't talked about yet. And yes, the World Health Organization finally got around to adding GLP-1s to their list of essential medications. Now, this is like, how does this change anything for us in the United States anytime soon? No, but I think it's more fodder for the insurance companies to feel pressure to have to cover these, with an organization like the WHO recognizing the importance in the fight against global obesity, and it is a global problem, that we incorporate these medications into the list of essential medications. And so hopefully this does lead to long-term better insurance adoption. But again, I'm not super bullish on increased insurance adoption over the near term, because the problem seems to be getting worse. It's like the cost of these medications has to come down ultimately. And, honestly, whether you like it or not, compounds are providing a market force that really does push the cost of these medications down. Now, investors in these companies don't love that. But for patients, it's ultimately a good thing when it comes to price and access. Bigger conversation, what does this do to peptide development long term? Because again, people with more severe disease need better medications or different medications. If we take our own iterations of peptides that help people with obesity. They're not, because it's not as easy as they want you to think it is. And there's one of the things that I always say in these conversations is there's no altruism. Compounders are not in the game to help you get healthy exclusively. They're in the game first and foremost for profit, just like the pharmaceutical companies. So if you're going to knock the pharmaceutical companies against that, you can knock the peptide manufacturers against that too, because everybody's in this for money. That's evil. I don't think that there's something intrinsically evil about wanting to make money. I make money doing On the Pen. I provide for my family doing On the Pen. I think it's a noble thing for a person to want to provide for their family. I think it's a natural thing for somebody who wants to provide for their family. But when that steps over the line into greed, which is a much more sort of nebulous concept, I think it's harder to figure out who's inherently evil and who's not. And so I sort of reject the idea that doing anything for profit is a negative thing. It's really what drives innovation and why we have these medications that we have. This is, again, my personal opinion. I know other people will have other opinions, but I think we have to get better about two things in the United States. We have to have just more civil conversations about this stuff if we ever want to accomplish anything. For starters, we just have to learn again how to have civil conversations with our neighbor. And those civil conversations are not likely taking place on social media. Those conversations are taking place in the real world. Get out and talk to your neighbors. Get out and get involved in civic organizations. Get involved in advocacy organizations like the OAC, the Obesity Action Coalition. Get involved and have conversations, right? But one of the things that I believe our system is too heavily weighted on right now is on drug patents. Drug patents, I do believe, are important for the sanctity of innovation. If you lived with a rare chronic disease, I think part of what elevates the whole conversation about our broken system right now with GLP-1s is that so many people live with diabetes and obesity. That is a really good thing, and it is forcing this conversation and this narrative forward about our broken healthcare system. But I do believe that drug patents are too heavily weighted in this country because we do want to protect innovation. We do want to protect the private enterprise that has pushed the innovation of these drugs. That said, a lot of these drugs have public funding dollars behind them to ultimately develop them in the first place. So like semaglutide was developed in the United States with public dollars. And so we have to balance this conversation about intellectual property with what good is an innovation if nobody can access it, right? And chronic, like really rare chronic diseases are those diseases like, maybe 1 in 100,000 people lives with it. The only reason we have a drug for it is because there's profit to be made. But how much profit should be made and for how long before there are options that are affordable and accessible to people? And this is the real conversation that has to happen. I think the other thing that very obviously has to happen with our system is we have got to get rid of the PBMs. These are the middlemen that offer nothing and take everything from our healthcare system. We have to, there's nothing meaningful that can be done unless we either circumvent or eliminate PBMs in our country, at least get it so these insurance companies can't own them. Because ultimately what happened is with the passage of the Affordable Care Act, it capped how profitable a healthcare insurance company could be at 15%. They have to invest the rest of their profits back into efficiencies within their own business, or they have to pay it back in claims. But the interesting thing is to that here in the United States. Again, if you missed it, I apologize. I have Starlink here at the camper. It likes to go in and out. I'm gonna change it so I'm off of cellular here on TikTok. But if I drop out for a second, it's because we're on Starlink internet here. Welcome, Traces of Twan. Good to see you here. Let's see. Dawn says the main problem I run into asking my doctor is that they're just not educated. Yeah, I mean, unfortunately, what we see is that a lot of doctors haven't gotten educated on this in an appropriate way. And so that's why we want to help educate you as patients here with On the Pen. That's what we're doing. Hey, if everybody can pause right now, my main goal for this from a business, always have a business perspective angle when I do any piece of content. If you can help me by going and following my Instagram channel right now, it's in the, either if you're watching on YouTube, it's in the link of the description of this video. The link tree is, if you're watching on X, it's in the description of the video. If you're watching on TikTok, it's in my bio. The link tree is in my bio, but just go over and follow my Instagram. I'm actually under account ban warning over on TikTok. And so I'm trying to migrate as many people as I can from TikTok over to Instagram. Now, it's not that Instagram's that much better, but we got to stay in touch somehow if this goes away. And that's what's under threat right now is my TikTok. So do me a favor, follow me on Instagram. We put a lot of short form content up there. And if TikTok, if I go away on TikTok, it's very unlikely that I'll bother coming back. I can't stand the censorship that's happening on this platform. I find it to be discriminatory against people living with the disease of obesity. We're just trying to have conversations and empower people to have better conversations with their doctors. And if TikTok's going to take that away, I just can't be on board with that platform anymore. And so we'll find people where they'll find us. Instagram is the next largest platform that we're on. So I just hope that you'll take a moment and let me know in the chats if you do it. Take a moment to jump over and follow our Instagram account. Our goal is to get to 15,000 followers on Instagram by the end of this live. I think we needed about 200 followers to do it. My midterm goal is to get to 20,000. So I would greatly appreciate that. Again, come back and let me know in the comments. I'll mention you by name if I see it scroll by. And thank you personally for that. Spoonie's over on TikTok. They removed some of her cancer content. See, it's unbelievable what is happening in terms of censorship. I think I get that they have to target some of it, or they feel like they have to target some of it because some of it is not helpful and some of it may borderline on harmful content. But at the same time, people are responsible for their own health. They're responsible for doing their own research, and nobody should ever be taking, and this includes me, taking what I say with a grain of salt and looking up the information for yourself. Because, excuse me, friends, because even with all the research that I do, I get it wrong from time to time. wrong from time to time. So I'm at Man on the Moonjaro on Instagram, or if you go to my link tree, my Instagram is right there and there's a follow button. It's very easy to just go to my link tree and hit follow there. So I appreciate that. Akawartaru. I'm trying to work with this name here. Akawataru found me on Instagram and followed. Thank you for that. I really appreciate that. Twyla's looking for me too. Thank you for that. I appreciate that. Now, according to Mike, he says Tesamorelin is the most amazing peptide created, but pales in comparison to the weight loss that you would get from a GLP-1 type peptide. I appreciate your contribution to the stream today. We need 200 more followers on Instagram. Between all the channels right now, we have over 300 people tuning into the live stream. So if you could just do me a favor, if you're on Instagram, go over and follow, and then drop in the comments if you did follow. I would greatly appreciate that. Thank you for the follow, Pete. I appreciate that. Mirror, thank you for the follow over. I know you said you're new to Instagram, so thank you for the follow over there. That's where a lot of our short form content is going to go if we get lost here. How do you watch a live on Insta? So I don't go live on Instagram right now, but if TikTok goes away, that's where these lives will go to. It's very easy to go live there. It's harder to go live from StreamYard, but it's pretty easy to go live from the app. I will be doing that as well. I just only have one device with me besides my laptop to be able to do it. So how are you, bud? You're back?
Mm-hmm.
Do you have any questions for me this time? You just same question. You just want that $20, don't you?
Mm-hmm.
Yeah. How do you think you might earn $20 of your own to spend on that if you want it that bad? What are some things you might do?
Well, I don't know how to spend it on that.
Well, but if you wanted to earn $20 of your own and have your own $20 to spend on it, and I would help you do it, how might you earn that $20? What might you do to earn $20?
Mm-hmm.
Any ideas?
Hmm.
Just be a handsome kid. He is a handsome guy. I love him. He's a good boy.
Can you do it?
Not right now, bud.
Are you almost done?
Mow the lawn. A 5-year-old? I'm almost done. I'll be done. How about I'll be done in 9 minutes?
Then will you?
We'll talk about it. How about that?
Mm-hmm.
I love you. You're a good guy. You know that?
Mm-hmm.
Your daddy loves you. A whole bunch. Do you know that?
Mm.
Does anybody else do the unfortunate parent behavior of talking baby talk to your 5-year-old? He's our baby. Benny is our baby. He is our youngest of 4. And I find myself not saying any words appropriately. I'm sure there's people with very strong opinions about that, but I just can't help it because he's my little guy.
Dad, we don't actually have 4 kids. We have 5.
Well, because of Ella. Yeah, they know about Ella. What is the game? So it's a Minecraft add-on that he's looking for. So the kids love Minecraft. If you don't know about Minecraft, Minecraft is like a very rudimentarily designed video game that's very similar to playing Legos. And our kids also love Legos, so I don't want you to think that our kids are.
Minecraft Legos.
They do.
And I always play with them, but now I don't.
Yeah. Well, it's harder when we're at the camper because we don't have our stuff here, right? Don't fall on that, buddy. You got to pull the leg out, and so it sits out correctly. Because if you sit in it like that, it could fall. Oh. Well, yeah, you're getting it. You're getting it. You got to pull it away from the camper because it's going to bump into it. It's not going to go out all the way. That's the way I talk to Sue the dude on the phone too. Baby talk. Yeah. Nicknames. So the 2 things that I do that drive my kids nuts the most is probably my funny voices that I talk to them in, and nicknames. Nicknames. My daughter especially hates nicknames, but she's my cheaty one. All right.
She likes nicknames.
She does. Oh, that made me so happy, Ben. How about ya? Okay. Let's hear from a couple more people. Not finding me on Instagram is on the pen. Yeah, you're gonna find me there as @ManOnTheMoonjaro. But if you go to my link tree, which is linked right in my TikTok bio, if you click that, it's right there. So I'm @ManOnTheMoonjaro. Oh, Trina has a Benny too. That's awesome. Mike lost 100 pounds on keto and fasting. Tesamorelin got rid of the rest of the horrible visceral fat left. And tirzepatide tamed the lifelong 40 years of binging. Amazing. I'm really glad to hear that for you, Mike. Wait, Mike, are you Mike Wolverine, Mike? It's hard for me to keep track of the screen names across, but I think that's Wolverine, Mike. Mike, you're my guy. I like you a lot. Can I get Manjaro? Are you diabetic? You're going to have to, like, a great way to find out if you have insurance coverage for GLP-1s is to use the GLP insurance checker tool through Row, which is also linked in my link tree. So check out my link tree, and you'll find that, and they'll do the checking for you if you don't know how to check it yourself. Otherwise, just call your insurance company. But then you have to spend time on the phone with your insurance company, which is about as fun as a lobotomy. All symptoms of diabetes without high A1C. You could definitely fight a denial if you're denied for it through our friends at Claimable. There is a clinical trial for tirzepatide that actually shows that 94% of patients who are pre-diabetic do not become diabetic when they start therapy for tirzepatide. So you want to avoid getting diabetes. I would definitely talk to your doctor about the potential of these treatments to help you avoid getting diabetes. That's one of the biggest things that I think we can take these medications for, is to avoid the pitfall of diabetes anywhere. No, it's not the same, Mike. Okay, good to know. Trina has a Benny too. I love it. Nancy talks to the grandchildren and the dog like that. I definitely talk to my dog in baby talk because she's a good girl. She's a good girl. What happened to Cigna's $200 out of pocket? That was a specific Cigna plan through Evernorth, right? I'd have to familiarize myself with it again. But Evernorth, which is I think a subsidiary of Cigna, maybe manages some of their formularies, had a max out of pocket for GLP-1 set at $200. So yeah, amazing. Nancy lost 75 pounds on Mounjaro and feels great. I love it, Nancy. Congratulations to you for getting your health back and your life back. How are we doing on that goal to get to 15,000 followers on Instagram? Are we there yet? I am. Let's see here. I think we need roughly 200 more followers. So thank you for those who have followed recently. Twyla, Jalali, Jay, Hippolito, Ms. Brown, Michelle Tedder, thank you for the follow. I appreciate that. Michelle, I see you. Jules followed. Twyla followed. I appreciate that. Thanks for everyone who's following. Zippy filled out the CVS Caremark form for the lawsuit. Awesome. So the one that's got a form up right now, I think, is for the specifically for the sleep apnea one. That's not the one that I'm talking about. But the one for the CVS denials over Wegovy, that is one that we'll be bringing you some information soon on how to get involved in that as well. So amazing. Really appreciate that. Let's see here. We've got Twan. It says she's down 128 pounds using Zepbound and Wegovy. Amazing. Congratulations on getting your life back. You'll do my best. You'll email your database of 50,000 real estate clients. You never know, we can get you some followers. I'd appreciate that a ton, Mike. If you would be willing to do that, I would greatly appreciate that. Thank you, buddy. I appreciate you. Bright Light said Express Scripts and Cigna are Evernorth now. The stuff is so complicated. It's so hard to follow every little thread there is. Like at first, when I started covering this news, sometimes it was a struggle to put together a weekly show of the news because there was so little that came out. Now I feel like I could do almost a daily show. And I may do that at some point, but just depends on how much you want to keep informed with the news. Probably the most news comes from the short form stuff right now, that and our Substack, which is our newsletter, which you can sign up for in our Linktree as well. I can't tell you enough how important it is right now to visit our Linktree, because our Linktree has so many resources for you to help you on your journey. Whether you're trying to get cheaper Wegovy, cheaper Ozempic, Lilly vials, you're trying to maybe get on a clinical trial, there's links for all of that stuff there. Plus you can follow our Instagram account and help us to reach our goal of getting to 15,000 followers today. Now we have got between TikTok and the other places that we are streaming, which include X and YouTube and LinkedIn, we've got over 300 people watching the live right now. So if you could follow me somewhere else, that'd be great. There is no form yet for the trial, the lawsuit that Claimable is organized. That will be forthcoming in the next couple of days. Stay tuned to my Linktree for that. And I'll make content on that, so make sure you're following me everywhere. Dorothy Knapp shared the live. Now, Dorothy Knapp is of no relation, but I don't know if you knew this, Dorothy. My name is Dave Knapp, spelled Knapp. I'm the man on the Mounjaro. It's good to have you here, Dorothy. We're probably not related, but that's pretty cool that we have the same last name. Let's see. Holly said you can't wait to hear about that lawsuit. Caremark denied my appeal. We're actually going to have somebody from Claimable on the podcast this week talking about this lawsuit and how you can get involved. Okay, so here you go. Our podcast drops every Tuesday around noon Central Time ish, give or take an hour, depending on what's going on in the news that day. But wherever you get your podcast, and if you could leave us a 5-star rating and review, that helps tell other people that that podcast is worth watching. Now we just hit an hour on this live, so I think I'm going to let y'all go because my kids deserve some more of their daddy time. We went to the zoo this morning. There's a zoo nearby that has Benny, what did we see at the zoo today? It's like a free little nature zoo. We saw a bobcat. One fat owl. He was a fat owl too, wasn't he? He was a big guy. The great horned owl, they call it.
His eyes were like sad.
His eyes were sad, probably because he's in a cage. Would you be sad if you had to be in a cage all day? Yeah, and like they're probably sad because they can't fly. But you know why they have those animals there? Is because they find them when they're injured, and then they help them get healthy again there. But then they're too injured to ever go back, and so we get to look at them and learn about them. But that place saved those animals from dying, so that's pretty cool, isn't it? We saw a bald eagle, we saw some ducks, we saw a bobcat, we saw a skunk. Did you like the skunk?
And a raccoon.
And a raccoon. And a fox. And bison. Did we see some bison? Some big old bison, didn't we? So yeah. We are. I'm at the camper. I will I don't know how well this is gonna play, but I'm gonna pick up the so we are at our camper here. So if you ever wanted to get a view of our camper, I may lose my connection by doing this, but this is our camper here. See the windows? I love the windows. And then like this is the money shot, right? When we turn around, like look at the reflection of the foliage in the camper windows. I love that. It like does something special in my heart place. But then if you look behind me, this is our view. A beautiful lake. It's a well manicured place that we're at here. Really, really love this place. It's my happy place. But with that, I'm going to end this live stream. Please go follow the Instagram account. The link is in the description over on YouTube. It's in my link tree if you're watching on TikTok. So please go follow. We're trying to get to 15,000 by the end of the weekend. I was hoping that we could get there on this live, but I don't think we quite will. And I'm going to go spend some time with my boys. I will be home tonight, so there will be no fireplace. Hopefully there's a little fire back home, if you know what I mean. Going back home to the wife, and she's got our daughter there too. So we'll probably be cleaning up and heading out soon. But I just really appreciate each and every one of you for hanging out with me today. Thank you for being the best part of what we do at On the Pen. I couldn't, wouldn't, and shouldn't do it without y'all. You all are very special people to me. So I just want to say thank you for everything that you do for me. I will continue to do what I'm doing for you. I just ask that you go follow on Instagram and do all the things. Cannot wait. Cannot wait. I'll keep you posted on how and if Benny earns $20. My sense is when there is labor involved in that $20, he gets a lot less interested really fast. The 5-year-old is, we got to learn him a few things, but Benny's my little buddy guy, kid. I love you, bud. He's a good kid. I just want to tackle him sometimes. Hey, you little stinker. All right, guys. Thanks for hanging out with me. Appreciate y'all. Bye.